So the next part of our afternoon, we wanted to kind of have just a discussion among some pediatric endocrinologists, because pediatric endocrinology is not a single entity. And you can actually have several different career paths within this field. So I'm going to have, how am I going to do this? Okay, since the camera is facing that way, Dr. Krishnan, Dr. Meyer, Dr. George, Dr. Regani, you want to come be a part of this because you're a little different than the rest of us. Line up some chairs. Duke, come on up. You're on. You're on now. Bring the microphone with you. We just wanted to kind of give you an idea from some of us that really have. Oh, turn them around and be that way, because that's the camera right there, and they want to see you. Fabulous. Yeah, like that. Okay. Yeah, just kind of seeing if we can see everybody here. All right. Okay. I'm going the wrong way. Okay. I think that's got most. Oh no, I need to go back this way just a little bit. Okay, yeah, Dr. Krishnan, come around a little bit more, and then I will get okay, you like Dr. Rugani, get a little bit closer so I can get you in the frame. And then I'll come down there in a minute. We just wanted to kind of give you all a little bit of flavor to kind of see what each of us does. Each one of us has kind of a different role within pediatric endocrinology. And that way I'll do mine at the end and then kind of watch for questions. But if we could just start, Dr. Krishnan, I'll let you start. Who's got turn the microphone? And you just kind of introduce yourself, and then you can kind of tell what your path and your career in endocrinology looks like, if you don't mind.
So, thank you, Dr. Tregestedt. Thank you. Can you hear me well now? Okay, perfect. So as Dr. Tregestedt was saying, I'm Soumya Krishnan. I finished my fellowship at University of Oklahoma and stayed on as faculty at University of Oklahoma. So my path in pediatric endocrinology has been at the academic setting all through my career. I've been there for almost 15, 16 years. And I took on the role of education, resident education, and then went on to be the fellowship program director. So a big part of my, in the academic setting, my track is clinical educator pathway. I think as fellows, I think one thing that you all have to understand when you go on to apply for jobs is when you're going to the academic setting, there are many pathways that you can follow. And so that's something that you should get acclimatized, get yourself, you know what pathway is and what are the promotion opportunities in each pathway. So mine is clinical educator because I'm doing a little bit of education, and I'm also a clinician. My major job duties involves being a clinician. I think I'll let others speak, and then if people have questions, I can answer them.
Hi, my name is Ankor Regani. I am a pediatric endocrinologist in sort of the private practice setting here in Oklahoma City. So I graduated from fellowship at the University of Oklahoma, also did my residency here in pediatrics. So, life sometimes throws curveballs, and sometimes you are surprised by them. I think I had sort of almost over halfway through fellowship, probably thought I was going to stay in academia, at least right out of fellowship. And then sort of towards the end of my fellowship, it turns out that there's a large hospital system here in the city, in the state, by name of Integris, that was looking to start up a pediatric endocrinology clinic. So here's sort of like a new grad, has the opportunity to create something from scratch And it was like this, the gut reaction is to say, oh, no, absolutely not. You're right. But you sort of get these opportunities once in a while, if ever. And I thought, well, what's there to lose? I'll take it up and see what I can create. So we started with, so I've been doing that for over a year now, and started with basically no infrastructure, nothing. And have built it up, and it's been really interesting to kind of understand and see how the business aspect of medicine works, the marketing side that you really learn nothing about, honestly, through training. And then, of course, practicing pediatric endocrinology essentially full-time in the clinical setting. I do consult at the hospital. There's a PICU and NICU, as well as inpatient ward, sort of a hospital within hospital model. So I'm happy to chat more about this, but it's not exactly your conventional track.
All right. Well, thank you, Dr. Regani. And, obviously, I think we feel like we took a big part in that, leadership there. So glad to hear all that good news. So I'm Jonathan Meyer. I know you saw me earlier. So I'm from Texas originally, did my med school in Galveston and my residency in San Antonio. Came here for fellowship at OU and stayed, and have enjoyed all of it so far. Like Dr. Krishnan, my path is probably most similar to hers. I am mostly a clinician, probably averaging between 6 and 7 half-day clinics a week. And I think that's something that as trainees, as we will all go through, have to decide if you're going to look more besides academia versus private practice within academics. How much clinic are you looking at versus research versus education versus other things? And so that's where I've ended up on for the time being, and I'm pretty happy with that, because I do focus a lot on clinic work. My other things I do within that realm include being the Oklahoma Endo Newborn Screening Director, as well as leading our DSD clinic. And so that has afforded me those opportunities, which I'm very grateful for. I've also been able to do some clinical research within those realms, and obviously we'll be able to continue that going forward. Like Dr. Christian, I do a lot of education, and that's part of my job description as well. Basically, I guess maybe I do the education she doesn't do within our section. So I'm not involved technically with the fellowship program, although certainly we talk about, I'm part of the program committee, and we do coordinate a lot of activities in that sense. And then I do all the resident and med student education within our section, as well as other trainees, which include adult endo fellows, reproductive endo fellows, and trying to also get even pre-med students most recently into OU to shadow, which has been a little bit of a difficult process, but working on it. So all those things are involved with what I do as well. And again, a fairly decent time commitment, but I think well worth it. And something that I imagined I'd probably be doing a lot as I was going through residency and fellowship, and I'm glad that I had the opportunity here to do that. So a lot of education stuff, I'm sure Dr. Christian and I can kind of answer.
All right, thank you. So we have had 3 fellows that went through our program here. I trained in New York City, in Brooklyn and Manhattan as part of my training and fellowship. And then Dr. Copeland recruited me to come out here to Oklahoma, and I've been here for the last 12 years. So my job description and the role has changed over the years, where I started out as a clinician, and then got involved in administration, including running the clinics with our clinic manager. And so serving as the medical director for the clinics. And also with that going forward, over the years and the performance of our clinics, I was able to take another role within the health system of being the pediatric physician experience champion. So that has been another role that has allowed me to get some more time to work with the entire department of pediatrics. And so within administration, there are opportunities and different roles that are out there, whether it's within pediatrics or within the enterprise or the medical school system. So there's different ways that you could get involved with your pediatric endocrine degree.
I'll say real quick, we have some, keep putting your comments in the chat. We'll let everybody kind of do their introductions and then I'll come back and moderate the questions from the chat. So please keep putting your questions in there. Thanks.
Well, thank you. It's an honor to be here. So to join the panels, and it seemed like I'm the most senior here, give and take. And my journey is somewhat a little bit different because I would just say that my journey diverges into a 3 different directions. Let's start with academia as a pediatric endocrinologist. So I did my fellowship. I graduated in 1996. So my first job is I land as the pediatric endocrinologist attending and the assistant professor at USC. And that time I joined as a tenure track. And again, you know, many of you know Fran Kaufman. She's very tough cookie. She recruited me and she made it clear to me that you stay on track. Don't get distracted. And did I listen? Not really. So what I did was I continue. I was asked to be co-director of fellowship program, write out fellowship. That's very interesting. I did that for 3 years. And after that, I find my niche. So I run pediatric bone program at USC, established in 2000. And since then, I continue. 2007, I got sidetracked. I got recruited to be board director of Human Growth Foundation. That's another hat I carry since then. And then at that time, I continued as a board director until 2011. I was elected as president, which is until today. The third hat, when I continue my career as pediatric endocrinologist, I overwhelming all clinical care and clinical research. I did a lot of clinical trials. At one point, I feel like maybe I need to go to the dark side, as people say that. So 2018, which is about 6 years ago, so I walked into the other side of pediatric endocrinologist. So I went to the pharma industry. Thank God I land into the role that's still dealing with pediatric endocrine disorder. And also, you know, our customer, you can say that when you're on the other side, is also pediatric endocrinologists. So anyway, I have been doing that and I joined one company. After 3 years, I moved to that company, which is now I'm at Lumos Pharma. The product that we're working on still in the pipeline of endocrinologists. So with that said, I'm juggling between these 3 hats, which is I'm currently wearing it. So in academia, I'm still going back to Children's Hospital Los Angeles. I have clinic there, bone clinic, which is I still conduct that clinic and I try to make it every couple of months. And every time I get there, we have 2 junior faculty working with me for full day clinic. And again, hopefully I can continue throughout my career. Human Growth Foundation, I stepped out as a president in 2011 because one of the pharma company that I joined earlier launching the product. So again, conflict of interest play a major role. When I left, SGF asked me to return to be president. So this year, I am the president of Human Growth Foundation again. So who knows when that can be an end. So, and lastly, career in pharma industry, which is again, you know, it's another direction that I think is very interesting. So I can tell you right now that not for everyone, but if you like it, you know what you're doing, it's very rewarding. So again, you know, I don't want to take up all the time, but anybody have question, I'll be glad to answer. Thank you.
It's kind of hard to follow that. I'm probably the least interesting and I won't give dates because that will age me. And I'm probably, yeah, I'm not going to go there. So my name is Andy Cagle. I'm a pediatric endocrinologist. I did my training at Indiana University. That's where I actually I did my medical school residency and fellowship there. I went out and worked in the community for about 10 years before finding my path in industry. It was a curveball that I managed to hit. And I can tell you, it allowed me to continue to do what I love to do in practice, as well as in training, is teach. I mean, that's what we do in industry. We we do scientific exchange, and there are a lot of opportunities to do that. You can also be involved in clinical trials. But my path has been mostly in medical affairs, where all we do is we talk to our fellow peers. I've been fortunate, like Duke, to be in the pediatric endocrine realm. And it's exciting to see there's more and more opportunities coming available as more and more medicines are coming to the market. So.
All right, now I'll come around here and be in the back for just a moment, because my career path is a little bit different than everyone else's here. So I'm Jeannie Trigestad again. I did my medical school residency, fellowship, training, everything here at OU, and then stayed on as faculty. I am a clinician scientist, so that is my track. I spend about 1 day a week seeing patients in clinic, and that kind of varies what that looks like. I'm actually contract health with our Chickasaw Nation here. So 1 week a month, I am in a clinic in Ada, Oklahoma. 1 day a month, Dr. George and I see exclusively patients with type 2 diabetes, because type 2 diabetes is one of my passions. I'll come back to in just a second. And then I also direct the Turner Syndrome Clinic here. So, and those are kind of my clinical hats. However, that's a very small portion of my time. My research interest focuses around youth with type 2 diabetes and the prenatal exposure, specifically maternal diabetes, that puts children at higher risk for diabetes in the future. So I received a training award, a K-23 from NIH, and then following that have an RO3. After that is specifically looking at how maternal diabetes impacts something called microRNAs, so little bitty pieces of RNA, within different cell types. So in human umbilical vein endothelial cells, in mesenchymal stem cells, how those are affected by these exposures. I was also very privileged to be involved in the Today study, and I'm going to be talking about that a little bit more on Sunday with Dr. Lynch back there, who is one of our partners as well. After our section chief, Dr. Copeland, retired, I took over as the PI here in Oklahoma for that study. And hopefully we'll be getting our notice of award soon and be starting another clinical consortium trial looking at predictors of diabetes in youth. So truthfully, most of my time is spent in research, and at present, mostly my research time is funded through federal grants. So I will pause there because there's already a question for Dr. Rugani. And let me get back up there and read that off to you. Please feel free to keep putting in your questions. So the first question was going to Dr. Rugani, and he said, what advice, this is to, I think it's Ms. McIver, or Dr. McIver. I'm going to say that because I don't want to mess up her first name. What advice do you give another ped endo who is interested in starting private practice? So lessons that you might have learned in the last year.
So so it's a really, really good question. And I appreciate you reaching out. So, you know, your first job's not always going to be your last. And what I did was I had wonderful mentors, but I just reached out to private practicing ped endos across the country. You just have to email them and say, hey, I'm a fellow here, I'm thinking about this. And then I just set up some time over the phone and talk to them, because I think the truth is that most pediatric endocrinologists and most of our excellent mentors generally have been in academia. So it's really hard to get a perspective of what is it really like on the other side. So that's what I did. And then at the end of the day, you just sort of weigh what you want. And so hopefully that answers some of your questions. At an earlier phase in life, so in residency, I actually took some time and spoke to private practice pediatricians as well. And so I had some notion of what may be involved.
Dr. McIver says, thank you. All right. Any other questions in the chat? Or I know that we have some trainees in the room. If there are other questions or thoughts. Let me go back, or did you go said, Dr. Christian?
Yeah, I wanted to, add to what Dr.
I don't know if
Rugani.
you're on.
Yeah, I wanted to add to what Dr. Rugani was mentioning, to reach out to people. The value of that cannot be understated. When I started my academic career, I wanted to build up the bone clinic, and that's exactly what I did. Reach out to other people nationally who are doing it. And, and it's just amazing how much help I've gotten from everybody. So pediatric endocrinologists are in general very helpful and very friendly. So.
And there are only like, I think 1,500 or so in the country. Okay. So pretty much everyone knows everyone or has heard of them and has met someone at meetings, and I think are really want to help you. So don't be shy to reach out.
Just pointing out that one of our fellows at the FDA, so there's other governmental options as well. Ashwini now. No, she left. What? Industry. Oh, okay. Yes. But I
She started out at NIH. She was a clinician scientist at NIH.
Right.
So that we didn't talk about that per se. We kind of talked about the clinician scientist, but there's also the scientific track within NIH as an intramural researcher and scientist. We have just a few more minutes. You guys want to talk about, maybe you mentioned a little bit, but what's most rewarding to you? What do you enjoy most about the track that you picked?
It's the teaching part. I think all of us are natural teachers. I think in pediatric endocrinology, we all love to teach. And I think you can find that joy in any aspect of it. Industry does offer that opportunity. It's a great place to be on the cutting edge. And you can do in two different aspects. You can be an investigator and work in the clinical development department, which it's a track I didn't choose yet, but I have those opportunities available. But it's nice you teach other investigators about cutting edge research that's going on. On the other side where I'm at is the medical affairs side. And that's where we get to take data and meet with people. We gather insights, but we mostly just educate. We don't sell in the medicine side or the medical side of industry. I know we're considered the dark side, but we don't sell. We provide data, and we do it as balanced as we possibly can, and let people make the decision. I'll let Duke add what he wants. Duke is on both the medical affairs and the clinical development side. So
yeah, I kind of have opportunity to run both sides of the industry. So one thing that I got called and asked all the time, right? I'm really burned out. I want to think about, option to go to the industry. Where should I start? What should I do? And I said that number one, don't think that the job will be easier than what you're doing right now. Okay, so, and that's number one that I told everybody. Oftentimes I see quite a few in the past that walk into industry, after a few years they walk back, because you cannot walk into the industry and keep the title, I am the doctor, and make the decision. Those days is gone. So you're just one part of the team. It doesn't matter who the other in your team. They may not be a doctor. They may just have bachelor. They may have master, or not even have expertise and knowledge that you have. But the decision we make as a team. So what do you say is not final decision? We need to learn. Sometimes very hard for a lot of people that I know. So keep that in mind. The other thing that people thought, oh my God, you go to industry, the pay is much better. That's relative, right? So some, it might be, some is not. So not always. And the third one, oh my God, the job is easier than being a physician. That's not necessarily true. You need to think about physical and mental. Now, one can drain. Physical might be okay, but depend on the day. Eddie can tell you. Sometimes the work is very tough, but the other day is very easy. So it's depend, it's flexible, but as physician, we have a routine, right? Every day pretty much the same. But in terms of physical and mental drain is the most very impactful in terms of physician walk into the industry. You need to be able to handle those stress and the situation that you usually don't, right? As a physician, when you see patient, you usually make a decision, right? In the patient room, you make decision, the nurse take order, the fellow follow your order, you feel like you're the man. But that's a different story when you walk to the other side. So with that said, so last question people ask all the time, how do I start if I want to go there? So my suggestion based on my experience and what I've seen over the past, at least 10 years here is that you should have some clinical background. I think Andy will agree with that. Right after fellowship is very hard. You should be able to see patient in a few years. It's not what you want and get started. Some people luckier than the others, right? You get into the role that you're very happy. Some people not. You need to start from really the bottom, of the chain here. So, but one thing I can tell you right now, if you have connection, your, seniority, someone industry, reach out. They give you some guidance. If you're lucky, that position open, they will tag you along. And that's something is easier. With that said, I would just leave it as industry is not for everyone as a pediatric endocrinologist. Before you jump into the other side, you need to think very careful. Can you come back to practice? Of course, yes. But before you walk to the other side, you need to make sure now when you're coming back, the light may be different. That's all. Thank you.
All right, I'm going to jump in because we had another on the chat. For those of us that are on the clinical track, like in an academic setting, do you foresee any changes or novel approaches to how clinic administrators are approaching the RVU generation for physicians in non-procedural specialties? As Dr. George is laughing, we've recently been dealing with this.
Yeah, so the administrative role is always more enjoyable when you have leadership that listens to you, that is able to, that you're able to make positive changes. And so when you feel like things are beyond your control in some ways, when there is not that working relationship, I think it can be pretty frustrating. Now, specifically the RVU question, and as we know, more and more academic centers are coming under the branch of a health system. And unlike clinical FTE, where you do certain times of your week at different roles, there is the RVU feature now. We just recently are going to that RVU. And there's always the question of, who are you comparing yourself to? Is it the right group? Is it the right, private practice versus academicians? Are you being compared properly? And so there's a lot of variables, and we're kind of going through that right now at Oklahoma. So I think as an administrator, as we're just going through it, I don't have a whole lot to add, but I would say that whenever you have a good working relationship with your administration, there is always more joy. And when they listen to you and you're able to bring positive changes that makes it easier for your team, that is always a win-win.
I'll echo really quickly, having the appropriate benchmarks is really important in an RVU setting. And as pediatric endocrinologists, we are finding a few additional things. And I actually think that there may be some discussion of this on Sunday as well in the practice management section, but additional codes that, although we're not procedural, that we can use some of those to our benefit.
I'll say something really quickly as well. So I want to echo what Dr. George and Dr. Triga just said, and it's really nice. You know, you have the support of other administrators and those involved in that process. But I think that yes, using some of the other codes are very important. And if you look at, I'm assuming the question is more about broadly, maybe to some degree, compensation in general. And I think that for those of us who do more education as well, I think we're also looking for ways to be compensated for that, which I think are being looked at least in our sort of our program here at OU. So
Another one, Dr. Murgani, what are some of your challenges in private practice?
How much time do you have? No, I'm just joking. It's not that bad. So, you know, one of the things I miss is the sort of research aspect and discussion with colleagues. Now, my case is a bit unique in that typically you don't leave fellowship and go and start a new practice. And so, you know, I came from 3 years of basically thinking about really tough cases, research, writing, and then switching gears. So that's certainly been challenge is one word, but also just the flexibility and change of mindset a little bit. The second thing is learning this RVU system of which we speak. So this is sort of how the world works. Money is what keeps the lights on. And at a certain point, you just realize this is what you have to do. You know, I started with 0 patients and then you just sort of build up and build these relationships. In private practice, you really need to be available for your patients and the pediatricians who may call you with questions. And so don't let this scare you, but I am on call 24/7, 365. But I'm still here and I'm doing this and I've slept well and Dr. Meyer knows I run and I enjoy it. And so you can still maintain that life, which, you know, I didn't know if that was going to be possible or not. What happens when you get a tough case? Well, you reach out. I've actually had a case of Cushing disease, a real case. And I reached out to NIH and this patient went to the NIH and got treated and has come back and is doing well. And that's just an extremely rare case of an endocrinopathy that, you know, we think about and almost never see. And then there are others as well. So that's the scary stuff, right? You don't have, where's your backup? Who are you going to reach out to? What are you going to do if you get these cases? But there are always people around who want to help you. Anything else? Sort of 3 challenges.
All right. Hopefully that was helpful. All right. Well, I think we're drawing in on the hour. I'll give chat just another moment if there's any other questions. Anybody else have any parting what? Oh, audience, I'm sorry. Okay. Please run the microphone around.
Oh, yeah. Hello. Yes, for the industry folks, I just had a question. What was your biggest challenge transitioning from practice to industry? And how did you overcome that?
So my, I guess, biggest challenge when I transitioned over, but I continued part-time practice. So the biggest challenge was, and you know, pediatric endocrinology, you can do a lot over the phone. So a big part was just managing my time. I was essentially doing 2 jobs and, you know, I'd run to offices, educate, and then go to the hospital, do a consult, and then do all the phone follow-up calls. I was on call, well, 365 days a year, 24/7 as well, because I was a solo practitioner when I was out too. So that was probably the biggest challenge. But to Duke's point, you know, it is kind of, you know, losing that the ability to make decisions and losing the patient care. That was hard. It's hard to give up our patients. We all went into medicine for that. So the way I overcome that is I remind myself why I went into medicine and keep my focus on, I'm here to make a difference for patients, and that drives me, and it continues to drive me. And it makes my decisions a lot easier. You always get into that ethically, I'm going to the dark side. And I've always told myself, if I was ever asked to do anything that was unethical, it would be an easy decision just to quit. You can always go back into practice. You can. I really do believe that. And not burning bridges is trying not to burn bridges when you do make that change, because you might want to go back into practice. And the last thing is, to one point I do want to make that everybody else kind of made too, is if you're questioning to make that change, just like it was talked about earlier, all pediatric endocrinologists love to talk to pediatric endocrinologists. So, and we are all nice. So just reach out and ask questions if you believe you want to make that choice, and be happy to talk. I'll let Duke. What are your challenges, Duke?
Yeah, so this is a very good question, right? I don't know we have one clear answer to answer them all. So number one, you need to ask yourself what I'm getting into, right? So the challenge of transition from pediendo to industry, you must know what industry look like, what your position you get into. Most of us, before I joined industry, I have no idea. Do I understand the difference of field medical team? Do I understand the position of medical director? Is medical affairs different than clinical development? We have no idea, right? So I think now you have enough of us in the field. Before you make decision, you need to study, explore, try to see the differences, and ask yourself if that role fit for you. Good example, this happen all the time. If this is going to be the office position, do I need to move? Or this remote position, do I get into the field? Do I need to travel 50% of the time? Or I don't need to? So all that basic question you need to ask yourself. If you learn all of that, the transition will be much easier. Most of us didn't. I want to go to industry, whatever position available, I take it because I want to get out this mess, whatever I'm in right now, but not necessarily to be the right decision, right? So with that said, but again, when I did that, I know exactly that I don't want to do a full-time clinician anymore, but I don't want to give that up. So I have the deal that I'm going to see patient once a month, and the rest I ask myself, okay, hallelujah, what happened to me? Don't worry about it. I'll never come back. So I think you need to have those mindset. What Andy said is very clear. Decision making is a huge. If you were or you have done pediatric endocrinologist, you are the leader. You're in management team, you make decision. But when you go to industry, it depends what position you go in. You might not even get opportunity to even make decision or make a suggestion, right? They might not even ask you, right? So you say, what? Anyway, it is what it is. So I think that to learn more about the position, to learn more about what role that available, what role that's entail. I think that once you learn all of that, once you make transition, it's easier. I don't think that I would just say that no problem. Everything have problem, but at least transition will make it easier for you when you realize what you get into.
Can I ask a question then? I thought that once you go into industry, you could never come back. It's kind of like, that's not true at all.
Well, I think part of it, for example, if you're in private practice, right? You went to industry, because I saw a few at Children's Hospital that, the GI folks, they went to industry multiple times and they came back and they said, this is better. When I announced that I'm leaving, they said, do things twice. Don't go because look at me. And I told myself, I don't think we are the same. But anyway, so I think what you can do is that, like Andy said, if you're not satisfied in industry, you always can come back to be pediendo. You have that opportunity. And I've seen it happen over and over again. However, how many of those? I don't think it's many, right, Andy?
Well, I
Come back to the.
So yeah, my story, and part of that is I think what Duke's doing, I don't do anymore, but Duke continues a practice. And now I think industry allows you to do that, but you can't get paid for it. It's a pro bono thing, but it's nice to have that that experience. I did go into industry and then decided I'm not sure. I did go back into practice. So I spent 3 years in industry. Again, working part-time like Duke's doing now, but then went back into practice for about 3 years, really thought about it. And then like Duke said, you learn really, okay, which path do I want to take? And then I chose my path more wisely my second time in, and then I enjoyed it. So you can't go back. Yeah, you can't. It's not really the dark.
The other thing that I think that if you look back 20 years ago, majority of pediatric endocrinologists who actually went into industry, they are very senior, right? Or ready to retire because they know what the hell, so I collect some money in the other side. But that's not true anymore. Those days were gone. So if you think about industry, study it. The earlier you get in, your chance and to be someone really meaningful. And again, you know, what happened was, is like the rest of any type business. You start from the bottom, you're going up. But if your own company, you're not going up fast enough, move. You do a zigzag move, and guess what? You go at the top somewhere. But that's what I heard. And I've seen that all the time. And a lot of people always think that if I'm endocrinologist, I need to go into the industry that linked to endocrinologists. No. One, you start in industry long enough. The clinical trial, it doesn't matter what drug you're talking about, the process is not different. Medical care. Now, it might be harder to learn about mechanism of the drug and how the drug and side effect, etc. But guess what? You went to med school, you did residency training, you can do it. So don't limit it yourself. Opportunity is very important, but clearly what role you're going to get into. I think that's the most important to make decision before you join industry.
All right. Well, I know we're kind of coming in on the hour. I don't see anything else on the chat. One last time, anything else in our room before I? All right. Well, thank you all. Please help me thank our panelists today. We really do appreciate their time. Thank you. And we hope we kind of imparted on you all that there are many paths in pediatric endocrinology, and I can share from myself as well as everybody else here on the panel. Please feel free to reach out to us. We're very approachable and would be happy to chat with you.